Good afternoon, I'm Angela Conlon and I'm the Arts Coordinator for the Creating with Care project at Oxford Health Foundation Trust. We're going to spend this afternoon telling you a bit about the Creating with Care project, how it came about and our vision for the future.
Hello, good afternoon and welcome to Creating with Care. I am Paula Hart. I'm a dementia nurse specialist and safeguarding lead for Oxford Community Hospitals and co-founder of Creating with Care. So before Creating with Care was born, I worked in the community hospital as a specialist nurse, delivering care to patients across the hospital, leading on the assessment and planning of care for patients with mental health issues and for patients with cognitive impairment and dementia. I would often try to deliver therapeutic interventions, but was quite limited really due to not having a budget. So we'd have to be very imaginative and do things like afternoon teas and reminiscence groups that had a minimal cost outlay. Once Angela joined us and Creating with Care was born, it transformed really what we were able to achieve.
My work before Creating with Care focused on delivering dance sessions across a number of care homes. So when I saw the opportunity to develop the programme at Witney Community Hospital, I was confident that dance as an art form could transform a hospital stay for patients, but also be relevant to staff wellbeing. I often talk about a study that suggests thinking about dancing releases endorphins and could help people feel happier without even moving. I have since seen how this works from working one-to-one with patients, where we've talked about our dancing days, played music and reminisced without even moving and felt much better for it.
So throughout Creating with Care, it's been really important to myself and Angela that actually we deliver evidence-based interventions to ensure that what we are delivering to patients is in terms of best practice. So we have, been very clear in terms of collecting that evaluation at different points since we started. Throughout the first year, the project was independently evaluated by Dr. Kate Hamlin from the University of Oxford, who came along to lots of our sessions. She took a mixed method approach for evaluation. She collected feedback, completed evaluation forms with patients at the end of each activity, and also carried out some observational studies at some of the sessions. She held focus groups for the patients themselves, for staff and for their carers as well. The positive outcome that we had enabled the second year to be funded. In 2019 we carried out evaluations across all our activities again. As the project had grown and was being delivered across multiple sites, we were reassured that the wider project was still having positive impact and well-being of the patients and reflected the previous evaluations from 2 years earlier.
Much of the artwork around our community hospitals has been co-produced with patients and artists, like this wonderful bird vinyl, which is brightening up a otherwise dull stairway. In January 2019, we received some funding from Oxford Health Charity to extend the project from just the one hospital to 5 community hospitals across Oxfordshire. Since then, we've continued to go from strength to strength, with sessions in photography, art, mosaics, dance, music, vintage cabaret, drama, poetry, and even a bit of Shakespeare. There's been a variety of stimulating work to allow all patients the opportunity to take part, many of whom have enduring and complex conditions.
So behind every activity and the funding applications and the planning of the activity themselves, there is also consideration to risk assessment, risk planning and to infection control. And certainly on paper, bringing a horse into a hospital wouldn't necessarily work. There has to be an element of positive risk taking for the benefit and the well-being of the patients. So this was a lovely afternoon. A horse came on to the ward and we heard some wonderful stories from our patients, and one in particular of a patient who had spent their life caring for horses, was now living in a care home and thought they would never have an interaction with a horse again. And we were able to bring that to fruition for that patient. During the afternoon, they had some photos taken with the lovely Roxy and her carers. Roxy was well looked after during the event and brought a lot of joy to both the patients and the staff. And indeed, Roxy received a celebrity welcome.
This film shows a project that we've recently completed at Didcot Community Hospital. Both patients and staff at the hospital were involved in making a large mosaic for the garden. They all said they enjoyed the process, which helped with overall well-being and relaxation, as well as giving patients something to do to combat boredom and loneliness, really. The solar-themed 2-metre mosaic will now bring smiles all year round to patients and staff. It's sparkles in the sunshine, catching the light, and it's just a delight. One of the greatest moments of this project was when staff members came out to see the finished installation on the wall, and they just were brought to tears, really, by the experience that they had all taken part in.
So here we have another example of positive risk taking. We were doing a needle felting session, and on paper, sharp needles, stabbing motions, fingers doesn't necessarily work. And I have to say, it did give me a little bit of a sleepless night. However, during the session, this lady who was visually impaired came along and created this wonderful Christmas pudding. The sensory feedback that she had from the session, the sense of accomplishments, was absolutely overwhelming for her, and she was just so proud to show off this pudding that and she was going to take it home and hang on her Christmas tree once she was discharged.
One of the sessions that I've delivered recently with a patient who was particularly depressed after a car accident involved me sitting and talking to her about music. It turns out she loved classical music. So we did a simple mirroring exercise where she moved and I copied her movement. Myself in full PPE, at one point we reached out, touched fingertips, and then she hugged herself and she started crying. She then said that she'd forgotten how much she missed holding somebody. So we held hands until the end of the track, and afterwards she said she felt much better. She'd been holding in quite a lot of stress and felt that this had come out. The following day we had a musician in the garden, and she came into the day room to be able to hear and see that musician more clearly. Staff told me afterwards that it was the first time that she'd left her room, and she was so pleased that she'd been able to join us.
So during this session, this was Tales by the Fireside, where we had lovely fire projected onto the wall, and we had Pat, one of our lovely artists who was a poet in residence at the time, and we were creating a story. So all the patients were contributing, and the sense of engagement and togetherness that we had in the room was absolutely amazing. The patients, Pat gave the patients different hats during the afternoon and to contribute to the story. And actually what was really unusual and unexpected was the patients began taking on the characters of the hats. We had a lovely afternoon, and the sense of accomplishments once that story had been read back to the patients at the end was actually such a joy. So our project has been really keen in engaging the communities around each of our hospitals. And as you can see in this photo, we've been very lucky. We have had some wonderful schools come in and deliver, we've been able to deliver some intergenerational activities. We've had the nursery, as you can see there, that came in and had some wonderful outcomes from that. And the sixth form pupils that came in as well, we were also able to go out and deliver some dementia friends training and prepare them for coming in for the sights and the sounds that they see within the hospital, and also take their stories as well of their family members and their experiences of older people as well. And it was a really positive, we've had some really positive outcomes.
Throughout the pandemic, Creating with Care has continued to be innovative by delivering arts-based activities in what has been a challenging time for everyone. We have facilitated virtual arts activities, garden concerts, provided creative packs and art carts for each ward, along with one-to-one dance sessions. We've also supported patients with virtual calls and visits. This is our vision for the future, which we've already started working on. We want all patients to have the opportunity to discover the benefits of taking part in an art session.
Thank you for joining us today and hearing all about the work that Creating with Care has been doing. We look forward to answering all your questions, but for now it's a big goodbye from myself and Angela.